All right, everybody, we've got some people that are on their way. Angelica, Yolanda, I know they're on their way. Hopefully some others too. But welcome to the November meeting of the Medicaid Client Voice Council. My name is Jason Peterson, Deputy Chief of Community Engagement. I understand people having some obstacles getting here. I was in a meeting at DHS at 10 o'clock when I got a text from my daughter. She was at court over at the district courthouse for a traffic ticket, and her tire was flat. And so I ran over there, changed her tire, got her to Goodyear, still had time to get my McDonald's Diet Coke, and here we are. So I'm glad that you're all here. It's the final meeting for some of you. It's the halfway point for others. We'll be welcoming 9 or 10 new members to the Medicaid Client Voice Council at our January meeting. So for those of you who are here for the last time, including our chairperson, Kristen Arnold, thank you for your service. We'll do a lot more thanking in the second half of the meeting, but I'd like to give Kristen the opportunity as chairperson to welcome you all, and if she has any things that she'd like to say.
Wow, I can't believe it's already been 2 years. It's been a blessing and an honor, and I just want to say thank you for allowing me to be on the council and serve, and allowing DHS just having us be here and have this council, and allowing parents and guardians and members to share concerns and ideas. Truly blessing.
And Brandy Vaughter is our vice chairperson. She'll be our chairperson next year. Brandy, do you have any opening remarks?
I just want to say thank you to Kristen for serving the last 2 years, and reiterating what she said. Just thank you for letting us have a voice, and an avenue to get some questions answered has been the greatest asset, I think, for most of us.
Brandy made some special effort to be here following surgery after breaking several things in her leg, ankle, tibia, fibia. I don't know what else you could have broken. So she's in no weight-bearing mode, so thank you for being here. Unfortunately, our Secretary, Christy Putnam, and Deputy Secretary Janet Mann could not be here. They have other obligations, but they wish you all well, and thank you for your service. And we do have several of our other DHS leaders here in the room, including Elizabeth Pittman, who is going to be, the first hour is all about Elizabeth. She's got 2 different presentations, starting with dental coverage. If you haven't seen in the news, or if you haven't been to our meetings the last couple times, we made a change, a return to the fee-for-service model when it comes to dental care for Medicaid beneficiaries. So Elizabeth, she's the Division of Medical Services Director. She is here to remind the council of the reasons for this change, and also provide an update on how things are going nearly 3 weeks in. She's in touch with the call center. She knows what kind of calls are coming in and how things are going. So she's going to update you on that. By the way, some of our members will be participating virtually. They have my cell phone number. If they have questions as they listen to these presentations, they can text me their questions, and I will share them with leadership when the Q&A part arrives. So without further ado, Elizabeth?
Good morning. How is everybody? Unfortunately, I won't be here for the second half of the meeting, so let me go on ahead and start off by saying thank you guys so much for your service over the past 2 years, for the input that you've given. I think you've really helped strengthen our program. So as much as hopefully we've helped you guys learn more about Medicaid, just know that you've helped us learn more about what the client experience of Medicaid is and how to improve that. So we really do thank you for that. So dental managed care was how we delivered services for 7 years. Prior to November 1st of this year. We used 2 companies, Delta Dental of Arkansas and MCNA, to provide services to almost all of Medicaid beneficiaries who receive dental services. And that was somewhere between 600 and 700,000 individual lives that received their dental services through those 2 managed care companies. For children, that's anything they need under dental care. There are no limits to dental services for children. For adults, there was a limit of $500. So just be aware of those limits. Those remain in place. But we, after trying to put back out an RFP for bid or request for proposals, we received 4 vendor proposals that we were moving forward on. We were negotiating with those vendors, and those negotiations kind of came to a standstill. We weren't really able to reach agreement, and we pulled those negotiations back and tried to regroup on where we were going to go with the program. And after talking to leadership and several other people, we looked at all of the numbers that were being in front of us for dental as far as quality metrics, number of utilization of services, how much was it costing us. And we weren't really seeing a huge difference between what we were doing in managed care and what we had done in fee-for-service 8 years prior. Managed care companies weren't doing anything bad at all. They were doing exactly what we had asked them to do, but we weren't seeing the improvements we had hoped to see with managed care. So we decided to, at that point, pull it back, and in 5.5 months from the time we did that till November 1st, transition those 600 to 700,000 people to what we call fee-for-service dental, which means that now the dental providers bill us directly instead of going through a Delta Dental or MCNA company. It was a lot of work. So first off, I want to congratulate my team. I have a team of about 4 DMS employees, and several contractors who did this in 5.5 months. They got the system stood up, they got the beneficiary notifications out to explain to clients what that meant to them and how they were going to be able to access dental services. They started communicating with dental providers about what that meant. We got contracts in place to make sure we could have reviews for those dental services, to make sure that we had call centers to answer provider and beneficiary questions. We trained those call centers, some of which are housed right here at AFMC, to answer those questions, and we did all of that in 5.5 months. So that team really worked hard. They met every day to try to make this transition as smooth as possible. And I know you probably don't care a lot about dental, but I just want to brag on them for a minute. They have done that. We have gotten, let me pull the numbers, since November 1st, as of last Friday, we have almost 20,000 claims, and of those 20,000 claims that we have processed, we have a denial rate that's roughly the same as what we see in our medical services line. So, I mean, honestly, it's going pretty well, not without bumps. But if we're getting the same denial rate in that service line as we do in our regular medical, that's pretty good. We did have some providers call us and say they no longer wanted to provide services. A lot of those had actually already stopped providing Medicaid client services. They just hadn't proactively called and told us. And so when we made this transition, they did actually do that. One of the main reasons we get for why you don't want to see Medicaid clients anymore is rates. So I know we're all shocked about that. But because of that, we are actually doing a comprehensive review of our dental rates right now. We started that when we launched this program. I meet with the Dental Association every 2 weeks to talk about rates and codes and services and problems and all of that good stuff. So we are looking at that to see if we can try to get those providers back in, because most of them have said, because AFMC has done reach out to them and called them all individually, most have said that if we do look, they would be willing to look at coming back depending on what we did with this comprehensive review. So we're trying to move that along to try to get some of those dentists back. The one thing I do want to make sure you understand about it, though, is some of the things that as clients you may experience with dental. So prior to going back to fee-for-service, we had certain limits in place. We might have said you can only have one set of dentures for your lifetime, right? Because Medicaid can't afford to pay for a bunch of replacement dentures without an emergency or an extraordinary circumstance. We're probably only going to buy one set of dentures. Well, we don't have a way to go back and look at what Delta Dental, well, we do as DHS, but as the provider, they don't have a way to go back and look at what Delta Dental or MCNA might have paid for that client. So as a dentist provider sitting there going, I want to provide Elizabeth dentures, they can't tell if I got dentures in the past 7 years. So then they're kind of at risk of providing me dentures and hoping Medicaid's going to pay for it. That's not really fair. So because of that, we have elected to say it's like you went in and got new Medicaid insurance on November 1st. So everyone coming out of those two plans, it's like they just got Medicaid insurance on November 1st. We're not going to look at that history for those 7 years. So they would be able to get dentures and Medicaid fee-for-service. So we did that with all of our limits, yearly, annual. So the $500 limit, the cleanings limits, all of those kind of started over for those clients on November 1st. So do keep that in mind. If you do have dental insurance with us or dental coverage with us, those restarted on November 1st. And that's kind of the big thing for beneficiaries to keep in mind. Other than that, AFMC does run a call center if you're having trouble finding a dental home. We do have a Find a Provider website navigation tool that Gainwell runs for us. It is as up to date as the information that the providers have given us. So that means the phone number that they have, the services that they provide, if they're still taking Medicaid clients, that is all as up to date as what they have told us. So if you call them and they say, we're not taking Medicaid clients, or you call them and that number's not working, that's why. Call AFMC and they will help you find a dentist. And that's two of the primary things I wanted to get across. So any questions about dental? I know it's not the most exciting topic, but I've learned a lot about teeth in the past 5.5 months.
All right.
Yes, ma'am.
Hold on.
My daughter is in the middle of a treatment plan for a Class C bite, which is an underbite. How is that going to affect? Because I know she had to have prior approval in order to start the treatment. So
Yes, ma'am. Good question. And I will be happy to answer as much as I can. And if we have any other questions, I'll get you a number you can call, okay? So we are actually honoring any treatment prior authorizations that Delta Dental or MCNA had put in place. We have agreements with the carriers on who will pay for it depending on where you are in that treatment plan. So the treatment should be able to continue and it will get covered. So that's first thing. If that doesn't happen, you need to reach out to us because that is the agreement we put in place with them. And again, it just depends on where you are in that treatment plan on whether the bill will go to us or them, but the coverage itself is there. You're welcome.
Any other questions? I had one question.
Yes.
So the call center's been open for a few weeks.
Yes, sir.
Are you familiar with what types of calls we're generally getting?
So we're getting more calls from providers than beneficiaries. The biggest calls from beneficiaries haven't really changed overall. They're what are my services? What can I get? Who can I go to? But the calls from providers, the history question came up, and then there's questions around what we prior authorize or require you to get approval for before you provide the service. It's a little bit different than what the carriers did, and so we're having to kind of try to work through that. So those are the two main issues.
So I know there was a lot of anxiety leading into this. Has it gone better than expected or better than we hoped, or?
I would say yes. I think we have had some hiccups as we expected. Anytime you transition, whether you have 5 months to prepare, 5 years, you're going to experience some hiccups. Given our short time frame, though, I think it has gone much better than expected, and we are still working through issues. But like I said, we reach out we meet with those dentists biweekly, and so I get lists of their issues at those meetings to try to address them.
Okay, Erica Grazer-Gates, one of our council members who's online with us, says with a $500 limit, it covers x-rays, and then there's not enough for a deep cleaning. Will you be looking at this issue?
We are looking at everything in the dental program, from rates to what we cover, to whether our codes are up to date, to whether or not that service actually needs a prior authorization. Now, everything we're looking at is subject to funding, obviously, but we are looking at all of that.
Okay, any other questions? No. All right. Let me give you a proper introduction for your next presentation then. You can stay up here. You can, it's up to you. So Maternal Life 360, another thing that's been in the news even in the last week because we opened up our first Maternal Life 360 in Jonesboro. Director Pittman will continue these updates by informing the council of that opening, and there might be a second opening by the time of the meeting. We're real close. Maybe it already has. Life 360 homes are designed to help pregnant women who are most at risk. Elizabeth's about to share about both the short-term and long-term goals for this program and answer questions from any of you about this. So,
Thank you.
all right, thanks.
So I'll start with Life 360 Homes. Gavin is right. We just had our first one open this month at St. Bernard's in Jonesboro. They are already seeing clients, and we actually have a grand opening event prepared, I believe, next week. So we're really excited about going up there and celebrating with them. They actually offer a pregnancy clinic to pregnant women in their area that was already providing free services. And so this is just a way for Medicaid to help bolster that already very exciting program up there. We also are this close to starting a second program in Batesville with, I believe, White River Hospital. We are in the process of finalizing their agreement right now, and as soon as that agreement gets finalized, they'll be able to start seeing clients. Both of those programs are using Parents as Teachers home visiting program, and so they're able to send home visitors into the home to work with pregnant women during the pregnancy and then for up to 2 years after the birth of the child, so they can continue those home visits. They both have referral networks put in place, and they both, particularly Batesville, use bilingual home visitors. Batesville has actually hired a home visitor who is specifically for the Hispanic population, and she is bilingual, and so we're really excited about that. We also are working with a hospital here in Little Rock, who also has hired several bilingual home visitors and also has a free pregnancy clinic here in Little Rock, and we're hoping to open that one up within the next year. So very excited about the progress that we've made. All right, so for maternal health, not just Life 360 Homes, this is a picture from a slide deck I think I presented to you guys about 6 months ago. It's from when the governor did an executive order for maternal health, and you can see our secretary and I believe our deputy secretary there with the governor. She's signing the order, and she has several of her staff members, their wives and or babies there in that picture. So it was a nice moment. It was a good celebration. But the governor's proposal is that if we help moms be healthy and help babies be healthy, then we can help families to have healthy lives and communities to be more healthy. And so that's the whole goal here. You start with the mom and the baby, and then it goes out from there. So I'm going to talk to you a little bit today about the task force recommendations. That task force that she signed that executive order for has actually met, and they have issued some recommendations. And what does that mean for Arkansas Medicaid? What are we going to do with that? So this is just a little overview of Medicaid, and I'm going to look at my, oh, that's much better. All right. We cover 1 in 3 Arkansans of all ages. So about 1/3 of the Arkansas population does receive some form of Medicaid service. That may be a TEFRA service, that may be a waiver service, that may be a traditional Medicaid service. We cover 50% of all births. Actually, we cover more than 50% of all births if you add our home in. We cover closer to 60% of all births in the state of Arkansas. So you really do have to include us in a conversation about maternal health. We cover about 50% of all children. So 1 in 2 children are actually on some form of Medicaid. Again, it could be TEFRA, it could be ARC-Kids A or B. And we cover 80% of all behavioral health services in this state. So while private insurance does cover behavioral health, we cover the majority of it, and we cover more of the continuum, all the way up to those higher needs, home and community-based services for people with mental health or substance use disorder. We are what you call an expansion state, so that's our home. That means we cover what they call the new adult group. That's adults 19 to 64 who go up to 138% of poverty, and they do not have to have children. For this population, we are the only state in the country that does it this way, but we purchase private insurance. So we purchase qualified health plans from Blue Cross or Centene, your Ambetter plans, for those individuals to receive coverage, the same plan that you can go on the marketplace and purchase, any one of us. That's what we as Medicaid purchase for those clients. We do have a very small managed care program, which I know a lot of you in this room are familiar with. It's the provider-led Arkansas Shared Savings Entity, or PASS, and we have about 40 to 45,000 people in that program at any given time. They all have behavioral health or intellectual developmental disability diagnosis, and they all have functional deficits that require home and community-based services. We do not currently have 12 months postpartum coverage. The reason for this is that we feel that all women in Arkansas have access to coverage today with the programs that we offer. Like I said, we through the QHPs purchase private insurance for women up to 138% of poverty. If those women exceed that, they would then be able to go to the federal marketplace and get the same plan that they already have with us. And the federal marketplace offers subsidies up to 400% of the federal poverty level, so they can get financial assistance there as well. But all pregnant women who are in Medicaid do get full Medicaid benefits. So we do cover pregnant women, I believe, up to 212% of the federal poverty, somewhere around there. Mary can tell me if I'm wrong. 214% of the poverty level. So all of those women up to 214%, regardless of their category, get full Medicaid benefits. They can get everything. They can get the dental services. They can get the behavioral health services. This is something that a lot of people don't realize we changed. We changed it, I believe, in 2021. And so I hear a lot from providers that we don't provide pregnant women with mental health services, with counseling. That's not true, we do. So if you hear that from women who are pregnant, remind them, let them know, no, Medicaid changed that in 2021 and you can get all the services now, because that's a big deal for pregnant women. There's a lot of prenatal and postnatal depression, and so being able to access those services is pretty important. And we do have what we call an HRSN, or Health-Related Social Needs Program. That's the Life 360 program that I just told you about. And in that program, they do an assessment for what we call HRSN. That would be things like housing needs, food needs, childcare, education, job, anything like that. Could be mental health services. They will screen them to see what those needs are, and then they make community referrals within their community. CMS has approved us to give some financial assistance for housing needs or nutrition needs if they score at a certain level on that assessment. So that was really exciting as well. We had never actually gotten that funding before. So this is the first program where CMS has said you can help with housing and or food. So yay, it's a step. So what did the task force recommend? They recommended that we evaluate reimbursement for maternal health across the board. I know you're surprised, but yet again, our rates were considered to be maybe not optimal, and also not just our rates, but the way we pay. So the way we pay for maternal health services for the obstetrician is what we call a global payment, and that global payment includes all the prenatal services, the delivery, and the postpartum visit. And you get paid the same amount no matter how many prenatal services you provide or whether or not that postpartum occurs. And so it's really hard, for one thing, to incentivize any sort of behavior on either side of that. The other thing is it's really hard for us as Medicaid to know what services were provided to those women. We don't know how many prenatal visits they got until that final claim comes in. We don't know what was provided at those visits, all of that kind of information. So we're trying to look at how we do that, how we pay for it, and how we collect that information. That includes everything from family planning and contraception. Another thing, though, I do want to plug, though, is Medicaid does pay for long-acting reversible contraception. We pay for any type of contraception, but the IUDs or the implants, like the ones you get put in your arm, we will pay for those at the time of delivery in the hospital, and we do not include it as part of this global payment. Something else I'm not sure people all realize, we did that a couple of years ago as well. So birth spacing is one of the big issues Arkansas is facing. Educating women on the importance of not getting pregnant immediately after you just delivered. It causes a lot of complications and health problems for the woman. And so we put this in place to help providers so they don't have to schedule and get that woman back after she's delivered, because, I mean, I'm sure as moms, you guys all know, that's not always very easy. So this just allows that conversation to occur, and if the woman wants it at that time, she can have that device put in. And the hospital and the provider can get paid for it. So again, plugging that, it's a good thing that we've done to help women to make decisions for their own life and their own bodies. So. We are working on implementing presumptive eligibility for pregnant women, and I will let Mary speak a little bit more to that if she wants, but what this will do is allow us to put a limited service package in place for women who are pregnant, and the provider does some minimal calculations and determines they're most likely eligible for Medicaid. So they can fill out a presumptive eligibility application. To get full benefits, the woman does have to complete the application within a certain amount of time and get approved. But one of the biggest complaints we heard during the task force was that providers won't take women who aren't already covered. So even if they know they can get retroactive coverage after the woman gets Medicaid, they don't want to take that risk that she won't complete that application or won't be eligible. So they won't take her. So this would allow the woman to go ahead and start receiving those services while that application was pending. And so we're hoping this allows women to access prenatal care sooner. We are improving the identification and referral of pregnant and postpartum women at risk of losing coverage. Again, Mary is here and is working on this more than me, but I get the joy of presenting this. Sorry, Mary. But basically what I was saying about we believe women have coverage through our home and then into the marketplace, what we do think is not happening is a good warm handoff. We think those women are getting lost in that transition because we're not doing a good job of identifying them and making sure they go through the correct process. And we do have a process in place where their names get sent to the marketplace, but there's no real follow-up after that to see what's going on. So Mary can tell you more about what they're doing and how they're doing it in line with the federal regulations if you would like to know, but that is something that she's working on. We are also being asked to increase telehealth usage and expand options for mobile units. We have some things in place right now for telehealth. You may have heard of the ANGELS program through UAMS that Medicaid helps sponsor. It's a high-risk OB program, but we want to expand it out beyond just these limited programs so that women in rural areas can access obstetricians and specialists without having to drive to Little Rock or Fayetteville or Bentonville or those areas where those specialists may be. We are also looking at mobile units. There's some grants in place that do mobile unit healthcare for pregnant women, but we're looking at how can Medicaid better help sponsor that, again, to try to avoid having to travel. One of the big barriers we heard was transportation. And CMS has a rule in place that the Medicaid transportation has to be for the Medicaid client. So if you as a pregnant woman already have a child at home and you're trying to get to your prenatal visit, that child can't come with you. That's a barrier. So how do we get around that? And so that's why we're looking at some of these alternatives to treatment. And that's reduced transportation barriers. So we're looking at that too. We've talked to CMS about it to see what we can do. I do know the clinic here in Little Rock actually offers their own transportation to and from the clinic, and they don't have that barrier. So there are other providers out there looking at that as well. So what are we doing? We have applied for the Transforming Maternal Health, or TMA, grant. We have actually gotten our first round of questions back from CMS, which we take as a good sign. This grant is about a $17 million grant that allows us to work with providers to build out infrastructure for maternal health and to also do a new payment system for those providers. That's what we call value-based. So it creates incentives for providers to provide better care. The things that the grant is looking at align with the things that we as Medicaid are looking at. So we really wanted to apply for that and try to get that assistance. We are moving forward with presumptive eligibility and working with AID. We are working with the legislature, the health department, and the newly formed Doula Alliance. There are several different doula associations here in Arkansas. There's one that's affiliated with the national doula organization called DONA. There's also one that's more culturally based here in Arkansas that focuses on minority groups. And so we're working with all of those. They've come together and formed a Doula Alliance, and we are looking at them, how to add doula services with them. Then we are also looking at adding pregnancy metrics to our current programs. One of our programs is called IQI. It's Inpatient Quality Incentives. One of the metrics that we're looking at is syphilis testing at birth. So I don't know if you know or not, but nationally we're facing a crisis of congenital syphilis, which is syphilis passed from the mom to the baby. Across the nation, the numbers have gone up. It's pretty simple to test for and treat syphilis, and the standard is 3 tests per pregnancy. You do one initial visit, you do one in the 3rd trimester, and then at delivery. Typically, syphilis takes a round of antibiotics, and then you can help prevent passing it on. A child born with syphilis has a lot of complications, and so you really want to avoid that. And so one of the things we're looking at is that's a simple test with a simple round of antibiotics, is can we incentivize doing that? So, and that's what I think all I have today, and happy to take any questions on that. And I won't keep going because I think this is your presentation.
While you guys think of questions, I wanted to give Mary the opportunity. She mentioned you several times in the presentation. Maybe there's some things you'd like to add.
Sure. Good morning. Good morning, I think, still, everyone. We, so when we talk about pregnant women in Medicaid, I always like to mention that you can be in any category and receive services related to pregnancy. Women sometimes come into Medicaid and they're not pregnant, and maybe they're in the parent caretaker group, or maybe they're in the Our Home group, and then they are pregnant. So they can go to the doctor just like they would for any other medical related need and receive services, and Medicaid covers it. But we have a special set of categories that are specifically pregnancy related, so that if you come into Medicaid pregnant, for example, and you might qualify for Our Home, but we can't put you immediately in Our Home because of the pregnancy, so there's the pregnancy category. Our pregnancy coverage also goes up to 214% of the federal poverty level, and Our Home is 138%. So we have pregnant women throughout Medicaid. That's a point I want to make. And we typically do renewals. Well, we don't typically. We do complete a renewal. We're required to do renewals once a year. But we don't do them more often than that unless we happen to have the information available and we can go ahead and complete that renewal without asking for that adult to go out of their way to provide additional information for the purposes of renewal. So why does all that matter? Sometimes you might be in the middle of your pregnancy and you're due for renewal because, you know, of when you came into Medicaid. And we are working on ways to help women continue that coverage. We've done some changes recently that would, if we know that a woman is pregnant. Now, in the eligibility system, we know if they're in the pregnancy category that they're pregnant or postpartum, because that's a requirement of the category. But we don't necessarily know in those other categories unless the pregnant woman has reported to us, I'm pregnant. But we have done some functionality that when we know the woman is pregnant, even if you might normally be closed for a reason, we don't close that coverage, we continue it through postpartum. And regardless of which category, we do redetermine eligibility when we know someone is pregnant. We try to put them in another Medicaid category to continue their services for that pregnancy. And they can continue services, but think about that difference between our home 138 and the pregnancy limit coverage, which is 214. There's a group of women that unless their income changes, they're not typically going to qualify for ongoing Medicaid, and that's the group that we refer to the federal marketplace, to the exchange. So one of the things we want to get in place is an outreach campaign where we work to do some outreach, try to communicate directly with those moms, new moms, about what the next steps are. You know, based on the income we have for you, you're not going to qualify to continue in regular Medicaid, but you could shop on the exchange. How can we help you get connected there? Do you need help on next steps? Or do you have coverage and don't need additional coverage? Because Medicaid can be secondary. You can have other coverage, and some women do have other coverage, but if they qualify for Medicaid, then they use Medicaid for a secondary coverage to help reduce any out-of-pocket costs they might have through their primary insurance. So, and if they're losing coverage for some other reason, like I think one of the reasons other than not meeting the income limit could be related to child support enforcement. Federal law does require women, parents who receive Medicaid, who have a child receiving Medicaid, to cooperate with the child support enforcement unit to pursue medical support for that child from the non-custodial parent. Now, there are exceptions to that. It's called the good cause process. If there's a reason, like, you know, if the child was conceived due to rape or incest, or there's, you know, a violent history there where it's just dangerous to do the child support enforcement process, then we can allow good cause for that with some documentation. But otherwise, it's a requirement, but we suspend that requirement during the pregnancy and postpartum period. So sometimes what we see is at the end of that postpartum period, there was a child support sanction that was in place prior to the pregnancy that has not been cleared, and we have continued the coverage because of the pregnancy and the exception during pregnancy. But that's another example of some outreach that we can do. You might continue to be eligible for Medicaid for yourself if we can help, you know, if you can clear up this child support cooperation issue. And sometimes it's a matter of paperwork that's needed at the child support enforcement, or whatever action the child support enforcement office was needing to be completed and followed through. So our outreach campaign is going to be targeting things that we can help people work through or get connected to in order to continue health insurance, whether that's through Medicaid or through the marketplace. So that's what we have in mind and what we are working on as far as the outreach for those new moms postpartum. Anybody have any questions?
Any questions? No? None? Okay. I haven't gotten any from our online viewers either. So after lunch, we are going to allow the members to kind of wax poetic about their time on the council, whether it's been 2 years or 1 year, just kind of share their observations, their reasons why they joined, if those reasons are being, realized. Kristen Arnold, our chairperson, needs to leave. Her son has a Thanksgiving program at his school, so she has to get back to Conway. So she's going to take her lunch and go. So rather than wait for the slideshow in the second half of the meeting where you'll all have your opportunity, I'm going to let her just share a few thoughts right now about why she joined and what she's gotten out of the council in her 2 years.
Jason, you didn't prepare me. Well, I just wanted a voice. I serve for my brother. I'm his legal guardian and his sister. And he is autistic, and my family adopted him through the foster care system. And sometimes what we live and what, things can be a little bit better. So this council has been amazing, allowing us to have a voice and share ideas and concerns. And it's been such a blessing and such an honor. And that's my family. That's me, my husband, Cody. There's Lawrence to the right. And then Grayson, he is 6. Lawson, that's my baby, he's 5. And Weston's 8. And that's my mother-in-law to my right. Left, and that is Lawrence's waiver staff. And so that is my why, and I'm excited to see what happens next year and the years to come, and just thank you for this opportunity.
All right, thank you, Kristen. Sorry to put you on the spot, but I'm glad you had the opportunity to share that, and we're able to get your picture up there because everyone has submitted pictures. We'll be sharing pictures of all the members, whether they're here or not. And for those who aren't here, I have some of their comments that I'll share. But with that, why don't we break just about 10 minutes early for lunch? We'll come back in about a half hour. It's tzatziki's. We've never had tzatziki's before, so enjoy. And then, of course, I'm thankful to the folks here at AFMC. They always go all out on our November meetings for the members who are graduating with cupcakes and treats and cookies, so they've done another fantastic job with that. So we will reconvene in about 30 minutes. You all can enjoy your lunch. All right, welcome back from lunch, everyone. Hope you enjoyed the tzatziki's. Would anybody want to have that again in the future? For those who are returning next year? Yeah, that's good. Yeah, that's good stuff. A reminder for those who are watching online, I know that Michelle's out there and Erica's out there, Brittany might be out there, and others. You can text me if you have questions about our presentations and the next presentation. For those of you who have served on the council for over a year, you may remember Frank Helmer was one of our council members. He was really big at advocating for the Workers with Disabilities program. He felt like more people needed to know about this program. This program was a great benefit to him and others. They could work and not lose their Medicaid benefits. And so when I was contacted or heard about Shannon Long, who's our special guest speaker today, and how she has utilized this program and how it's made a difference in her life, we thought it would be nice to not only learn about a program, but hear about a program from someone who actually benefits from it and can tell you how it has changed her life. So Shannon Long is here. She's got a PowerPoint presentation. She's going to come up, and I'm going to move this microphone over so you can use it. And welcome, Shannon.
Test the waters. Well, sounds like you can hear me. Is that good? It sounds like an echo, but oh, that might be it. I got it. Yes, the feedback. Hello, hello. Is that good? Okay.
Turn these off just in case. All right, try that.
Okay, is that good? Can everyone hear me? Okay. Well, my name's Shannon. Thank you, Jason, for inviting me to this. And a shout out to Jennifer Breeze, who referred me as well. I'm going to use the same PowerPoint I did with her, because October is National Disability Employment Awareness Month, but we can bring awareness to this topic every month of every year. Okay. Okay, well, I'm with Project AWIN, Project Arkansas Work Incentives Network. We are part of the WIPA program through Social Security. The WIPA program is a grant-funded initiative called the Work Incentives Planning and Assistance Program. And we help individuals who are on SSI and SSDI, we help provide information on Social Security work incentives so they can make informed decisions about their work goals, and this includes state and Medicaid programs. So I'm a certified work incentive coordinator, a CWIC for short, and we are trained through VCU, Virginia Commonwealth University, which is also funded by the Social Security Administration. Let's see. So today I'm going to talk about a little bit of my backstory and then how I've utilized these DHS programs and then what I do on a daily basis. So a little bit of my background. I had a car accident when I was 17 in 2003. I spent 3 months at Children's, and I can't say enough blessings about Children's. It's a great hospital. But when I was there, of course, when something like this happens, they throw a lot of different resources and information at you all at once. But I was introduced to Arkansas Rehab Services and also the Spinal Cord Commission, which kind of helped in my planning to go from the hospital to home. So at that time, my mother filed for SSI, supplemental security income, so that we could have some income as a person with a disability. So I started getting Medicaid, as well as that supplement. Now, after my accident, it was my senior year of high school, so I finished my senior year online, and it was my goal to still go to college. So I didn't want this to stop me. In Hot Springs, there was the Arkansas Career Training Institute, which is the old Army Naval Hospital. They've shut it down, but it was a place where individuals with disabilities could go and get training on different programs, the VOTEC programs. But while they were there, they had a medical floor where there was 24-hour care. So I decided to go there. There were other individuals with quadriplegia there. So they transported us to and from college. So I went to National Park Community College, which is now a 4-year college. Right there, I met my then boyfriend, now husband, at National Park. So we spent a lot of time together. He kind of got me out of my shell. So I wasn't really talkative or really engaged with any people at that time. So he really kind of got my confidence up, and has been and is a great support to me. So, okay. So now we knew we both wanted to continue our education. So we both moved to Conway in 2006, where we were enrolled with UCA. Now, at that time, I knew about the waiver, but the Alternatives for Physical Disabilities waiver, the APD waiver, now it's Arkansas Choices waiver, but you had to be 21 before you could apply for it. So when we moved to Conway, that's when I turned 21. So immediately we started getting services. And Robert was my paid caregiver while we were in college. So I obtained my bachelor's degree of sociology in 2009, and then I started working for Sources. Sources for Community Independent Living Services is my employer. It's a nonprofit out of Fayetteville, and they receive the grant funding through Social Security, by which I'm paid. So I started working for them in 2009, and I worked for them from 2009 to 2012. So at that time, there was problems with the funding, so they let us go for about a year. At that time, I was on SSI. I got to retain my Medicaid under 1619B, which is a work incentive under SSI. But I also wanted to keep my waiver. So the limit for the waiver is 300% of the federal benefit rate, which is actually very generous. But at that time, it still limited me to where I couldn't work full-time. I had to cut back my hours. So, yeah, on months with a 5-week pay period, I had to take off a week. And we do get annual bonuses because we work off a grant. And I had to turn those down, which was really awful for me. But, so that was that period of my life. In the summer of 2012, right, we were let go for, again, a year. I was paid out for my vacation. So at that time, DHS was reviewing me, and they kind of flagged that and said I had to pay back all that money for that month. Later, I found out I was actually categorically eligible during that time. And through a lot of emails and help with people at DHS, Jack Tyner, I was able to get that money back. So we reversed that decision. I'm kind of like the trailblazer who's like been burned, and I've gone through all the ups and downs that I know, like how to and who to get things done at DHS. So there's that. Oh, come on. Okay. So my ultimate goal was to get on the Working Disabled Medicaid program. So this program has no income limit, no asset limit, and no resource limit. It does have an unearned income limit of the SSI federal benefit rate plus $20, which is $963, for this year. So if you have any unearned income above $960, which includes VA benefits or disability benefits, you technically don't qualify for it. So when I got laid off, I applied for disability. And because I'm a young person, you actually, someone young, can accrue credits at a very young age and entitle themselves to disability quicker than adults can at times. Social Security has a whole formula about how they calculate credits, and obviously because when you're on disability, you get paid when you pay into those FICA taxes. Obviously, that's a disability program that someone's entitled to. So at that time, I started getting disability. So for that whole year, I had to work part-time because with my disability payment plus my work earnings, I was going to exceed the waiver limit. So Social Security has a great period. It wasn't so great for me, but when someone's on disability and they go to work, there's a 9-month trial work period where they're guaranteed their disability payment no matter what. So I had to work a year to try to get off disability so that I could apply for and get on the Working Disabled program. So during that year, I worked part-time and I got my disability payment. So between the two, I was right under the waiver limit. And at that time, I also went to Euler to get my master's in rehab counseling. So I made use of all these times to the benefit of me. So again, my ultimate goal was to get off disability. So after a year, it's 9 months, and there's a 3-month grace period. But after a year, my disability payment stopped. And I then could apply for the Working Disabled Medicaid program because I have no income limits. My unearned income is 0, and I didn't have any assets at that time. So again, I applied for this program. It was approved in 2014 under the MSB 300. I think that's MSB 330 now. And because I'm also on waiver, the Working Disabled Medicaid category is an optional waiver for individuals, or is it optional, it's an optional Medicaid category that an individual with waivers and who's working could still apply for. And as long as they meet the financial criteria under Working Disabled Medicaid program and the medical criteria for waivers, they can get on this program. And a lot of DHS individuals have denied people because you can't be in two Medicaid categories at once, but yes, you can. That's covered under C-145 in the policy manual. So when I got on Working Disabled Medicaid program, I immediately started working full-time, started growing my savings account. Every Medicaid category typically has a resource limit of $2,000 a month. So I started saving. I didn't have to stress about 5-week pay periods. I started to receive my annual bonuses. I was able to sign up for an employer-sponsored retirement plan, 403B. So I could also set up an ABLE account. Now, an ABLE account, Achieving Better Life Experiences, is an account where individuals who are on means-tested programs, so waiver or food stamps, they can actually put their money in an ABLE account, and it'll be excluded as a resource. This is only for individuals who have their onset of disability under age 26, which I heard in Congress they're trying to raise, and it will go up. It takes a long time to get like policy changes from when you once it's, and Congress has been passed. So, and I got married in 2017. So obviously Robert was my paid caregiver during college. But once we both graduated, we both got jobs. We were able to let go of that financial safety net that held us up for so many years. So again, I got married in 2017. And I continued to receive my waiver and my attendant care. Go ahead. So I call it the Working Disabled Medicaid program. It's like the Cadillac program for any individual who's disabled and wants to go to work and can work. The requirements for this program, again, you have to have a disability. If you are not on SSI or SSDI prior to applying for this program, they can make a medical determination through their medical review team. And again, you have the unearned income limit has to be below the SSI federal benefit rate plus $20, except for earned income would be income eligible to receive SSI. I've had some DHS workers deny cases because they weren't previously eligible for SSI. But all this is stating is if you accept for earned income, would you otherwise be eligible for disability? And what they mean is would you meet the medical criteria to qualify for SSI and or disability? So there's no income test, there's no resource limit. You can be dual eligible under waiver and the Working Disabled Medicaid program. Again, as long as you meet the medical criteria of the waiver and the financial criteria of the Working Disabled Medicaid program, you can be on this program and have both. You can have both your cake and eat it too. So, anyways, come on. All right. Oh, independent scouts. Okay, so that was kind of a quick overview of how I got on the Working Disabled Medicaid program. So, okay, Miss Mayberry, Representative Mayberry, I met her in the Capitol when the ABLE program was getting passed. She was the one that introduced that legislation to Congress. And when I met her, she had her daughter there. Her daughter's disabled. And her daughter was the first one to sign up for an ABLE program. Again, these are programs where if someone's below the age of 26 and is disabled, they can put their income and resources in the ABLE program. And again, it's not counted as a resource. Now, these programs they're managed through, I think, the Fifth Third Bank out of Missouri, or just the Fifth Third Bank. It might be in other states. So it's actual bank, it's actual savings account through a bank, and anyone who's getting a savings account would apply for it just like they would apply for any other account with a bank. But it is through, Arkansas has their own ABLE program and a place where you can apply for it. So anyways, I met her there, and I told her something came to my realization. As an individual with a disability, I'm aware if I'm not on the working disabled Medicaid program and I retire, my retirement savings, my resources are going to make me ineligible for the waiver. And that's really not fair for DHS to have a program like the working disabled Medicaid program that puts no limits on me whatsoever to be able to save my assets and resources and have a retirement plan. And then all of a sudden, once I'm not on that, I'm just going to be ineligible for, the waiver. That's the one that keeps me in the community, taken care of, so I don't have to go into like a nursing home or anything like that. So I brought this to her attention, and she was like, you know what? We'll be in a session in 2 more years. Why don't you bring that to my attention then? So sure enough, 2 years later, I called her. She gave me her number, and so through my work, my TA liaison out of, I think it's Wisconsin, they had someone else who was in their legislative body who had a disability and had a type of paraplegia and had the waiver. So they had this, the way they excluded it in Congress, she got me in contact with several people up there, and they sent me the actual legislation that the state of Wisconsin had. And I basically just sent that over to Miss Mayberry, and she basically just did it verbatim the same way that it's done in Wisconsin. But so what this policy does, and luckily I had Nikki Cox at DHS was able to give me training on what's called the independence accounts. So in the legislation, any individual who is on waiver and is off on the working disabled Medicaid program can claim their savings, their 403B plan, whatever banking that you had while you're on the working disabled Medicaid program, you could claim those as what's called independence accounts, and they'll be excluded as a resource even when someone's not on the working disabled Medicaid program anymore. So these slides I basically copied from the training I had at DHS. So they're new to me, but basically these accounts will be 100% disregarded for all A, B, D categories of healthcare. There are no legal documents to set one up. The account statements must be provided to DHS. And as long as they hold the savings of employment earnings or retirement funds while you're getting the work disabled Medicaid program, they'll be excluded once that, again, that safety net is kind of as long as ended. And members may also designate multiple accounts. So I was excited when I first read how the policy was written. And of course, they give you that period of time where you can provide comments, and it didn't make any sense to me. So I did email, I've sent my comments in, and I told them that I was the original drafter of the program, what it's meant to do, and what the complication is. So they don't really give you any feedback till the next year, and then it's published. So, but luckily they heard my message, and they did respond to it, and they fixed it exactly like I had wanted it to be written. So once I started getting training on this, I was really excited because I wanted DHS to interpret it in a certain way that it is. So an individual can have multiple independence accounts, and as long as you're reporting that to DHS, that has to be excluded. So, and that's brand new. I'm sure there's going to be some bad denials. So because I've been doing this, I've been doing what I've been doing for a little over 10 years. So our goal is to help people with disabilities understand these programs and navigate through both DHS and Social Security Administration. So I've helped a lot of people with individuals who's on waiver, who's also working full-time. There's not many of us. So when I was like proposing this to the legislature, I'm like, there's only, I think, at the time, Jack Tyner told me there was like 194 individuals on the working disabled Medicaid program. Only 5 of them had waivers. So I'm talking about a small body of individuals who, this is very life-changing to them if they don't have their waivers and they can't get the support out in the community. So that's pretty much it. Do you guys have any questions about, I'm not a DHS worker, but I probably know this program better than anyone, because we've had to make several changes when people are denied, and it's becoming more aware of through DHS. So I'm hoping throughout the years, the working disabled Medicaid program has grown. And that's in part due to hopefully myself and my coworkers. Any questions? And again, I'm also CWIC, so any individual who's on SSI or disability benefits who need to understand how working affects their benefits, I can answer those as well.
Hi, we met back in Sources before the pandemic. I don't think you remember me. It
Oh,
was a really long time ago.
okay.
And I wasn't aware you were working for Sources.
Oh,
But I remember at that time, Jim mentioned to us, I think it was the last time we were going to meet in person. It was like the Christmas open house or something. He mentioned something about him working on the state TBI program. And since I never heard anything, I want to know if you're participating in that and how that's going, and if you have any updates on that.
I don't, the traumatic brain injury.
Yes.
I know they have a group meeting every month, and some of it's virtual and some of it's in person, but thank goodness we had COVID. Not really. It really put everyone in like the Zoom mode.
Yeah.
So we started doing staff meetings over Zoom, and I work from home, so does my other coworkers. So we didn't like mingle with the staff of Sources. We were very much separate. We didn't know who each other was. But thanks to Zoom and COVID, we all know who each other is, and we all know each other's names, and it's gotten us as a staff really close and understanding what each person does under the independent living. So although I'm separately removed, I don't know a whole lot of their programs, what they're doing right now. So that would be probably better to contact Jim about. But I know Nicole is in charge of the traumatic brain injury classes or staff meetings that they do every month.
And the reason why I'm asking is because I know that I was looking at the requirements, and for the Medicaid-based disability, you have to qualify for both the waiver and something else. But I feel like you understand how it is to feel like, every way you turn it falls through the cracks, because my disability happened after I was 26. So I never qualified for any assistance, and my disability is not like a complete, even though it is a permanent disability. And I just feel like even through the TBI program, because mine is a mild TBI, not a severe, I always kind of get pushed to the side, even though my symptoms are like the same and affects me the same. And I just feel like it's hard to like gain that financial independence on your own without having to rely on state assistance. Because really, like, if it weren't for like me receiving like child support and disability for my daughter, other things that would qualify me, they still count that unearned income as part of resources that I get, and that still counts against me.
Yeah.
So I'm glad we reconnected, and I'm glad that I got to hear your story, because it's,
Well, if you want to talk after this,
Yeah.
it's fine. Okay,
Yeah.
so we do help with a lot of different work incentives, one of which is called the PASS program, where we've helped people pay for their college tuition, vehicle, a number of things. So each person's case is really different. So I could probably answer you guys' question, but when it comes to those complicated, kind of in the weeds question, again, each person has has an individual case and has to be dealt with kind of on a one-on-one time.
Any other questions?
No questions?
Also, I heard you use the term bad denials. It's really an issue of educating the DHS employees about these changing,
Right.
qualifications and new programs and new.
And a lot of individuals some individuals I've had apply for it, and within 2 weeks were approved. So it is becoming more widely known. Yes.
How many people do you advocate for, or do you help?
Oh, well, a lot of people.
A lot of people.
I mean, we usually have, I would say, at least 10 to 15 referrals every month.
Oh, wow.
So some of them are working, some of them are just information and referral.
Mhm.
Just kind of want to know about different things. But we really work with the individuals when they're working. So just to help them understand reporting and what's going to happen when. And we'll write reports for someone's short-term work goals or long-term work goals. Yeah.
Have you ever considered working for DHS?
You know,
Because
I
you
was
know a
saying,
lot about it.
as long as I've been doing this, these different programs, teachers should really start paying me.
Well,
So-
thank you so much for making time in your schedule to be with us and share about a program. I think it really helps when we not only learn about programs, but we learn from the people who benefit from them. So,
Thank you. Yeah, actually, I was denied my waiver 1 year. Actually, that was last year. No, it was this year. And anyways, I've got Christy Bramlett and Tori Stuck, and I was blowing up everyone's emails. Because, anyways, they all know me, so I'm the one pestering people and explaining they do qualify. But it's my understanding that because of their computer system now, there's a very much strategic way of getting people applied for waiver, closing that one day, then opening it the next. But that's DHS kind of way of, I know it's complicated the way they're doing it now because of their new system, but nonetheless, it could be done.
well, thank you, Shannon. Thank you so much. Sure. So now we get a chance to recognize and celebrate some of the 7 members from the MVC class of 2023 who have fulfilled their 2 years of service, and they'll be rotating off the council. This is their final meeting. Michelle Pedro, Gail Holloway, Kristen Arnold, Gary Hoover, Brittany Gilmore, Betty Rayford, and Yolanda Taylor. I'm going to give you all the opportunity of those of you who are here to share a few things, and those who aren't here, I believe I have their thoughts encapsulated, and I'll share their thoughts. Kristen was here earlier. If you came in late, she shared her thoughts. She's our exiting chairperson. Just to summarize, she wrote this also. She didn't know I was going to spring it on her. She said, "Thank you for allowing me to serve on the council. Thank you, DHS, for allowing families to have this platform to bring ideas and concerns. I'm excited to see what the new council will bring next year, handing the torch to Brandy." So she had shared that. Brittany is not here. She's next, one of our exiting members. She said, when she applied to be on the council, her application said, "I want to be a voice for the Black community and those in drug addiction recovery." And I think that for those of you who have been attending meetings, Brittany's also been a vocal advocate for those who battle mental health issues or health challenges. That's also one of her interests and reasons why she served. Gail is next. Gail's from Hardy. She said, "My husband and I are the parents of adult twin girls, both severely disabled. We're also legal guardians for an elementary-aged granddaughter with autism. I'm a retired Arkansas special education teacher. My husband and I are very concerned about the future of our children, and as caregivers, we appreciate hearing firsthand about the paths we are choosing." She enjoyed having input in the decision-making process. Gary also couldn't be here tonight. Gary Hoover, Kevin. He said, I will not be able to attend due to a family commitment. It has been an honor to serve on the council and has been a great learning experience and has been very eye-opening. He appreciates DHS listening to the people who are served by these programs. Michelle Pedro is in Springdale. She's watching online. Let's see if she didn't text me any updated messages. Erica had a question that I'll share with you in just a moment. Michelle said on her application, no, she said in an email she sent me on Thursday, the reason why I joined the Medicaid Client Voice Council is for people like me. I wanted to make sure that Marshallese who have felt unheard, unseen, and falling through the cracks had someone advocating for them. I wanted to make sure that people like Antonia, someone she's helping, who has cancer, diabetes, and other illnesses, were taken care of. I want them to know that people like the Medicaid Client Voice Council cares and are doing more than listening but taking action by problem solving. Antonia has told her that they have issues with receiving, keeping, and maintaining services, but since I've been able to voice their concerns and make connections with DHS, they have seen improvements. She and many Marshallese are her why. Betty from Pine Bluff is here. So Betty, I'm gonna bring you the microphone and you can share in your own words why you joined the council, why you serve, and what your 2 years has been like.
Hi. As you can see from the picture, that's why. Daniel is 37. He has Down syndrome. And I started working with services for individuals with disabilities when he was about 3, without much service from DHS because we didn't have services for him at that time. We applied for a waiver, and when he was 7, he got the waiver. He's been on the waiver ever since. And that's been a blessing. I can't describe all the things that we've gone through, but when I came onto the council, I wanted to go back and revisit some of the things and experiences that I'd had when he was younger, going through school, getting out of school, and what was going to be available to him after school. And yeah, I could see a tremendous amount of change. I kind of was anticipating maybe there won't be changes because it seemed like we were battling the same things we've been battling all of his life. But I see a difference in the want from DHS to make things better. And this has been an opportunity for me to voice my concerns and have them answered, and have seen tremendous improvement even just in the 2 years that I've been on the council. So sadly having to leave, but I think we're headed in the right direction, and I think there'll be people that'll come on board who have just as much compassion and interest in making services better for our individuals.
Thank you, Betty. Betty is our 6th of 7 council members who are rotating off. Yolanda Traylor is the 7th, so Yolanda.
Thank you. My name is Yolanda Traylor, and my reasoning for being there, if you look at that left picture on the bottom, the little one in, I can't say little because he's taller than everybody in the house now, but the one in the middle, he's the youngest one. Those are me and my 2 kids. But the one in the middle is the one that I advocate for daily. I never knew that when I applied to get my master's degree in 2017, that the next year that I will have a more important lesson to learn. And since 2018, he has been my class. He has taught me a lot in life as far as dealing with the behavior issues that he has going, his big emotions and his anxiety and his this depression and all the other big emotions that he has going on in life. So as an educator and a teacher, you know, I always tell people that we're not always the one teaching the kids. Sometimes they're teaching us. And so for me, I have been advocating for him and also taking more classes for me on this journey to understand his life and the things that he goes through instead of trying to force what we think things should be in society. So he has taught me a lot about grace and giving other people grace, and he has taught me about truly loving unconditionally and truly when you see other people in the world in society, not only just because I work in education and with parents and other families like that, but when you see people that have problems, to look beyond those problems that you see on the outside and try to find their why on the inside. So this journey with him we've had our ups and downs, but I'll do it every day. I wake up and do it again every day with him. And so that was my why, is just advocating for him, and not only for him, but people in our community who don't understand why their kids go through what they go through, or didn't know that, that you can have a past, and didn't realize that there were therapists for them, and didn't realize that, oh, I need therapy too, to actually deal with it, and didn't realize what respite care was. So this has been a beautiful journey with him, and another class that I'll close here today, but hopefully to join another class somewhere else to continue to learn all the things I need to do to continue to advocate for him.
Thank you, Yolanda. And Yolanda's daughter and my daughter went to Central High School together and knew one another. So the returning members, Erica Grazier Gates from Fayetteville is our first returning member. She sent some comments. She said she chose to work on the Medicaid Client Voice Council because not only is it important for myself as a disabled individual to have a voice, but I can benefit my community by utilizing the information which we share and receive to help others. When she applied to be on the council, she mentioned that she wanted to advocate for, lead, educate, and empower the underserved communities in our state. Working with nonprofit organizations and having my own nonprofit, I have worked to get bills passed, being a board member of the Arkansas State Independent Living Council, and being in an underserved minority group as a woman and someone who is disabled, and being a nurse before her spinal cord injury, I feel I can bring a unique perspective. I can continue to be a voice for the same Medicaid clients that I am already fighting for. Casey Kinchin of North Little Rock will be back with us next year. Let's hear from Casey.
I don't really have a lot to say, but here that's my youngest daughter. When I originally applied, my oldest daughter, who is now not on Medicaid, it was more so for her because she has a lot of issues related to asthma and allergies, and we had some problems there. We've since worked those out. My youngest, we've had some ups and downs with behavior, like you. So I've dealt with that, but mainly I teach pre-K, and the majority of the students there live in poverty, and they don't know their resources. Many of the parents don't, and I feel like I can be a good advocate and help share resources or places that they can turn to receive services that they may need, because even in pre-K, we have children that need mental health services and so on and so forth. So that's my why. I didn't share a picture of my pre-K babies because I didn't get a photo release, and I apologize.
No, that's fine. Better safe than sorry. Right. Heather Honecker texted me this morning. That's her why. Her daughter is sick, and that's why she couldn't be here today. But she says, my young daughter has Down syndrome. She is currently a Medicaid client and will be for the rest of her life. I want to learn more about the issues that will affect her and our family, and also be of service to those who are making decisions about her and kids like her. I've spent 20 years in nonprofit development, and I'm a freelance writer focusing on telling stories about interesting people and places. When my daughter was born, she was born with complex medical conditions, and we have spent a lot of her life in and out of hospitals and specialists' offices. I started my own blog to give an honest, raw look at what life with a kid like Ellie is like, and I have amassed a sizable following who enjoy learning about disability services and who are looking for ways to make their friends' lives easier. Rebecca Ledgerwood from Cash, she's following up her son's service on the council, wrapping up her first year. Her son Bradley served 2 years on the council. Rebecca.
Of course, I'm here because of him. He's the one on the right. He is actually his biggest advocate. He's very vocal, and I more assist him in his advocacy. But I'm very thankful for the program, the MCVC set up. I feel like there was a disconnect between clients and DHS, and I feel like we can see them a little better, and I hope they can see our struggles a little better, that it's not just paper, it's individuals. And I'm very grateful to have met many from DHS that I see in a different light now, and I'm very thankful for that.
Thank you, Rebecca. Brandy Vaughter has served as vice chairperson for this year. She will be our chairperson next year on the council. And so, Brandy?
Thank you. The people that you see up on the screen are just a small sample. I'm a board certified patient advocate, and so I work primarily with senior adults. The vast majority of my clients or patients don't have any family members, so they don't have anybody to advocate for them. And so in assisting them in finding resources, finding places to live, whether assisted living facilities or long-term care facilities. So this council, for me, has just opened up many doors and other resources and things that I was not aware of. And I've been able to share with DHS some of the obstacles that I have encountered in trying to advocate for these patients, and that they don't understand how to apply. It's very difficult for them to apply, the tedious process of document gathering and, you know, things of that nature. So I feel like I've been able to be a voice for that senior community.
And before I introduce our sixth and final returning council member, we have a committee that will be reviewing all of the applications that have come in to apply for the council. We'll be adding up to 9, maybe 10 new council members for next year. And so to get the number back up to around 16. So we'll be reviewing those and inviting new members to join the council in December. If they say yes, they'll be here at our first January meeting. So you'll have a whole bunch of new colleagues, you 6 returning members, to meet. But Angelica Yanez will be returning. She's from Rogers.
The picture on the left, that's my daughter when we started 2 years ago. And, you know, I just have a lot of respect for Yolanda and everyone else who has, you know, special needs child, because it's not for the weak. And especially when, as a parent and as a sole caregiver, you also have a disability. And that picture also, every time I see it, it's just a reminder, because just what it's like to have an invisible disability, because Shannon may know, but having a TBI, like, it's not, like, you're not in a wheelchair, you're able-bodied, but you have, like, when I have neurological fatigue, that's how I look like, and, like, even my appearance changes, and to me, it's kind of difficult to have to, like, explain to people, like, it's not something, like, I'm not just tired, it's like an actual, you know, like, it's not just chronic fatigue. But to me, that's why I'm doing it, because I feel like there's not a lot of help out there. And it's basically, you just have to, like Shannon, I know, like, why she keeps, I mean, I admire her that she keeps, like, looking for resources after, like, one door closes, because when you feel like everything is falling through the cracks, like, you just have to keep going.
I think Shannon made that clear in her story. Starting in 2003, you had a lot of information thrown at you, and you've been learning ever since about programs, benefits, processes, procedures. So we appreciate DHS. On behalf of DHS, we appreciate all of the service of our council members. We have made changes to programs that we believe will benefit Medicaid beneficiaries based on your suggestions. And so we want to keep it up. We want to keep it going. In 2025, we're going to add another council that's made up of some providers, some other people in this space. 3 or 4 of you will be invited to join that council. So we'll be considering that in the spring. Who's going to do both councils. for a period. Erica had sent me a text. This is probably going to go back to your presentation because I jumped ahead, but can we get your number via email? I was told by AR Choices the only thing that I could do was the work ticket program, and that I could only work 9 months in a 5-year span making a very low income. So I think she wants to get some information from you and see if that's accurate, and if not, what is accurate. So I will get, Erica, I will get her email and I will email it to you. So we'll take care of that. Unfortunately, Secretary and others, Elizabeth had to leave. We have a couple people with some vast DHS knowledge in the room. We end our meetings with an open question and answer session based on Medicaid related programs. If anyone has some questions, we'll do our best to answer it. If not, I will record the question and get an answer to you. So are there any questions before we wrap up for the open-ended period of the meeting? I know you guys know there's extra cookies out there and you probably want to get to them before everybody else. Yes?
I had a bag. When we left the house, we forgot my bag. I had pamphlets in it, and
Well,
I was going to provide that.
if you guys need more information about the things Shannon talked about, you email me. I've got her contact information. We can get any of the information. She should apply to be on the council, sure, yeah. There's still time. We haven't started reviewing the applications yet, so we really do appreciate, yeah, something else. Hey, we really do appreciate each and every one of you. For those who are rotating off, thank you for your 2 years. You'll be added to the alumni group of the council. You'll still get the newsletters. If we do a survey in the future, you'll be incorporated in the surveys. We haven't done any of those yet, but we still are looking for the right opportunity to do that. And you'll always have my email if you have a problem with a program or need an answer or need to find who the right person to contact is. My door is always open to you as former members. So with that, we will adjourn the November meeting of the Medicaid Client Voice Council. Thank you.